When Health World Web came to us with this idea, one of the things that we as Accelerator thought was really important to do is to step back and say, so what are some of the challenges that we've called out up front, that have to do with this potentially contentious relationship that can be or that is fostering potentially a contentious relationship between patients and providers? How do we make sure that any solution that's being proposed doesn't sort of promote that problematic relationship? So one of the things that we've talked about is how do we engage the real key stakeholders in this interaction, which do include the industry or the community, but also really are about patients who want to provide reviews and physicians or clinicians who ultimately are going to be the subject of reviews. How do we engage those stakeholders in such a way that we ensure any type of specification that's put forward or any effort that's moving forward has a level of buy-in or input at the outset to help improve its chances of being successful. There are also some issues that have to do with how folks that participate or potentially participate agree to play nicely, if you will, right? So if anybody's aggregating reviews, there's always the risk of somebody deciding to not really pay into that pool, if you will, or reciprocate, but just be a consumer of those reviews and poured reviews, if you will. So these are a few of the issues, and I think what we wanted to do today was not only just give Health World Web a chance to really put this concept out on the table and get some discussion, much in the same way that we had discussion around drug code lookup and namespaces, but also to introduce these kind of key considerations that we think are important and take advantage of having hospitals or plans, folks that may be contracting with or employing providers that might be subject to reviews, having actual physicians and clinicians in the room that want to think about the notion of somebody aggregating reviews and help infuse that thinking into this process so that as we're looking at what the appropriate next steps are for moving forward, it's not something that's purely a technical solution, but it's hopefully a proposed solution that addresses some of those practical considerations that we think are critical. So I guess I just encourage us to open it up to people's thoughts or feedback.
I think the idea of a physician